Hello, everyone. Welcome to our presentation today on the LLM in Global Health Law and Governance. We're delighted to have you. We have the director of the program and alumni who will be sharing their experiences to help you get a better sense and understanding of what an incredible joint program we host with the Graduate Institute in Switzerland, Geneva. But first, I'll begin just by giving you all a brief overview. My name is Sarah Bosha. I'm the director of the LLM in National and Global Health Law and of Health Law programs at Georgetown University, and I'm excited to welcome you all. I'm going to go ahead and share my screen so that I can begin the presentation for everyone. Please feel free to share your questions in the Q&A box as we are going. Any questions that you have either for myself or any of the guests that we have today. So just a quick overview of the health law programs at Georgetown, but specifically the O'Neill Institute for National and Global Health Law, which was founded in 2007 to increase research in global health law and help to advance legal and policy reform. We have over 30 experts, researchers, and scholars that work in different areas that include healthy food environments, tobacco control, and NCDs and infectious diseases. We also do work around substance use disorders, and we do a lot of global health governance work. The Institute itself serves as a home and a place of belonging, really, for both our health law LLM cohort when they're in Washington, D.C. The O'Neill Institute is also the only WHO collaborating center in the world, and we are responsible in that capacity for delivering technical support for implementing WHO and PAHO mandated work and program objectives, and also strengthening capacity in the US. So just a quick overview now of health law programs. So we have two flagship programs under our health law programs at Georgetown Law. We have the LLM in National and Global Health Law, and we have the LLM in Global Health Law and Governance, which is the focus of today's discussion. Students who take our LLM programs can also take different certificates if they want to deepen their specialization in any one of the areas that are listed here, including international human rights law, WTO studies, or food and drug law. I'm going to turn over now to my colleague from Geneva, Professor Gianluca Berci, who is the director of the program in Geneva, to talk a little bit more and share with us about the program and its benefits.
Thank you, Sarah, and good morning, good evening, good afternoon to everybody. So, as Sarah said, the joint LLM is a joint program between Georgetown and the Graduate Institute. I'm sure everybody knows Georgetown. Not everybody knows in detail about the Graduate Institute. So let me just say a couple of words about us. We were founded in 1927 as a very interdisciplinary institute on international governance and social sciences. The institute is about 1,000 students. It's not very big, but it's fundamentally international and about 80, 90 faculty. It has a number of academic programs, and the mix of the program between Georgetown and the Graduate Institute is that the spring semester will give you quite a portfolio of courses, not just law, but across the spectrum of the programs that are offered by the Institute, including history, political science, anthropology, development studies, and so on. So it's not just purely legal, but it gives you a chance to really go broader on what it means to study the governance of health. Could you, next slide, please? Yes. So here there are the credits you can see. On the right side are the credits that you accumulate during the spring semester at the Graduate Institute. It is actually only one mandatory course, which is my course on global health law. You will have seen that there is also the same course taught at Georgetown, but we take it from very, very different perspectives. So I will ask the alumni that are attending today whether they really found it repetitious, but the effort was to really cover the legal aspect of global health much from different perspectives. Of course, the European credits are different from US credits. We have full courses. There are 6 credits each. And you need to accumulate 24 credits, which means 4 full courses. Compulsory course, which is my course, and 3 other courses. The semester is a bit different from the US academic year. It starts in the second half of February, and the courses end at the end of May. And they're followed by an exam for those courses like mine that give a take-home exam. But fundamentally is those 3.5 months. Next slide, please. Yes, so this is to give you an idea of the courses that are available. This is not the full range. I think you have 15 courses available. Not all are open to exchange students. The compulsory one, for example, are not. But as you can see, they give you quite a broad perspective on global health, including courses on anthropology, courses on governance with Professor Suri Moon, who is a celebrity in health governance studies. So that gives you a bit of a flavor of what is offered at the institute during the spring semester. Next slide, please. And I give the floor to my colleague Olivia Kell to say a bit more about this aspect of the program.
Gianluca. Hello, everyone. So I'm Olivia Kell, and I'm the Academic Support Officer at the Geneva Graduate Institute. Just so you know, to continue on what Gianluca said, we're also here we know that you will be traveling to come here. So we'll really be here to also help you get everything you need with the visa to enter Switzerland. For your experience here that you will have with us, we're planning a few activities. We like to know our students. That's why we will organize a welcome breakfast here at the Institute, and you will have a full campus tour of our place. We're also planning to have a 1-day field trip in all the international organization, organization that we have here. We're really in the international neighborhood. This is where we're placed. We're really next to the United Nations, next to the World Health Organization. Last year, we were able to go there to also visit the organization Gavi, for example. And Professor Burchi has also a lot of ex-colleagues coming into his course that are presenting what they're doing. So you will have really this experience with professional in the field. And he's also able to get you some pass to attend the World Health Assembly here in Geneva. We also have a great career services here at the Institute that will help you get your CV and motivation letter on right to help you with your internships. So, yeah, that's all for me.
Thank you. Before we go to alumni testimonials, I forgot an important part of the program, which is a requirement to have to undergo an internship. That is, I think, a very much appreciated part of the program because it gives students the possibility of really working on what they have learned in the classroom. The internship is full-time. At least that's the requirement. So it will have to come after the end of the classes because it's impossible to attend 4 courses every week and at the same time have a full-time internship. Normally, students, in particular non-European students that come to Geneva, tend to stay in Geneva, wants to stay here. But it is not a requirement. Internships can be done anywhere in the world, provided obviously that they're health related. This can be in Geneva, for example, WHO, UNAIDS, if it still exists, the health partnerships. We have health NGOs. A number of students have done internship in the permanent missions, in the diplomatic missions of countries in Geneva, but it can be anywhere in the world. I believe Jasmine has done it in the US, not in Geneva. So normally these internships last 2 to 3 months, and they translate into 15 credits, which complete the 39 credits that are required to complete the program. In a few cases, they were very exceptional, in particular during COVID. Students could not do the internship. And so we offer, in lieu of an internship, a longer research paper. But obviously, that's a plan B. Students normally would like to work hands-on in health-related institutions. So I just wanted to add that because normally it's quite an important part of the program. So yeah, we can move to beside listening to my boring speech to the students that have really gone through the program. I have 4 alumni here, and I will let them introduce themselves. If you can say briefly, in particular, what you're doing now. And obviously, I'm sure that the students that attended, that are listening, are mostly interested, first of all, in what is your overall take on the program. Was it satisfactory? Were there gaps? Do you have any feedback? But in particular, did it help you? Did it help you in where you are now in your career path? Because obviously that's the most important thing that an academic program like this has to offer. So let me give the floor to the people I see on the screen in my order. And the first is Cindy Xian. If you can go ahead and introduce yourself and say what you think about the program. Thank you, Cindy.
Yes, thank you, Professor Birchie. Hi, my name is Cindy, and I'm now working at Davis Polk in its Beijing office. I attended the program like from 2024 to 2025, and like after I finished my spring semester in Geneva, I came back to China and start my work now as a lawyer. So many people may think it's surprising that my working now as a legal lawyer is very different from what I'm learning, like in the international organizations. But I actually want to express to you that if you choose this program, it doesn't mean that you can only choose the career path of being like an officer in the international organizations. What you learn from this program are actually the soft skills and like for my experience in the program, I would really appreciate like uh in the first semester I learned in Washington DC, which is also the center of international organizations. So I visited the World Bank, the IMF, and also besides those health law courses, I learned like international trade law, which is very conducive to my current path. And then in the Graduate Institute, besides the global health law, like taught by Professor Birchie, I also chose the international investment law, which helped me to deal with the dispute, like health-related disputes between individuals. So I think this course is really comprehensive, like compared to like other courses or other programs.
Thank you, Cindy. Very useful. And just to ask students that are listening to this, to if they have a question, to please use the Q&A. This is squeezed into an hour, so we don't have time to cover all the aspects of the program. But please feel free to ask any question on the Q&A, and we'll take them towards the end. Jasmine Howard, up to you.
Hi, I'm Jasmine Howard. I'm joining today from Boston, Massachusetts, USA. I did the LL.M program in 21, 22. I had previously had always been working in litigation, and I was really interested. I have a master's of public health, so I had some health background, but I really wanted to move out of sort of serving just individuals to understanding more of the sort of systems, governance, policy side of sort of both practicing law, but specifically practicing healthcare based law and global health. Uh, and currently, I work at Northeastern University in the School of Law. We have a grant funded initiative called Solus Populi. We educate the judiciary on the social determinants of health. So, for the last almost 2 years, I've been working with judges across the country in Puerto Rico, and then we're starting to get some judges in Canada too on sort of what's bringing litigants to court, how are health implications affected by judicial decision making. And it's been a great experience to sort of take what I learned in both Geneva and DC, sort of taking my class experience to sort of shift to think more about the sort of systems level understanding. Because I think very much when you're practicing law and sort of particularly practicing representing people or corporations, you're really sort of focused on those individual needs. Whereas when you're using that global health mindset, you're really thinking, learning about how do systems interact with various components of health of populations and of health of the environment and so forth and so on. But I think it really reset my framework of thinking. And that's what really allowed me to sort of move into this position that I have now, very much, um, you know, I think traditional law school under like your JD programs are really focused on, how you represent individuals, but you don't really have that bigger thinking in like how systems play into the other aspects of health. So I really appreciated that aspect of the program. I think otherwise, having the opportunity to sort of live in DC and then live in Geneva, uh, sort of experience uh, going into the different international organizations, talking to just random people that you meet on the bus, or I brought my dog at the dog park about what they do. I think it was a great opportunity to sort of expand. We ended up, I taken my dog to a park that was a few blocks from where the housing is, and I had on a Georgetown hat, and I met another Georgetown alumni who proceeded to say, "Oh, we have a Geneva alumni group. We'd love to host everyone for." Um, they had a specific name for it, but essentially happy hour. And so we did that. I thought, and subsequently, since graduating, I've gone to a number of Graduate Institute events in both DC and New York. They do a good job of uh, sort of sending out emails saying we're having either the equivalent of the president of the school come and do sort of speaker series, and then in the summer, they host an event at the Swiss embassy with the ambassador speaks, and sort of usually one professor flies in and talks about an area of research that is emerging. So I've really enjoyed sort of continuing to stay connected to both institutes, continue to learn, but I think the connections and the just the general knowledge that I have obtained, I've continued to take into my day to day. And I will say the other thing that I really appreciated in both parts of the program is there's a lot of opportunities to learn about ways to practice law sort of outside of the traditional, what I think of as either going to court or doing like transaction work. And I think that's something that I've also really appreciated because as I think about, oh, if I do this for a certain number of years, what I want to do next, I now know about substantially more opportunities in global health law that I can continue to practice in the healthcare space that I just didn't know existed before the program.
Great, thank you, Jasmine, and I hope you also your dog enjoyed the program. So,
Oh, yes, he
um,
definitely did.
good. Did I remember well that you did your internship in the US?
Yes. So I did my internship in the US for a firm that I had some relationship with prior, and they were taking on some PFAS cases that were specifically going to have an international element. So I was able to work with them. We were doing at that time a mix of a lot of client interviews and then just briefing international law to understand PFAS are the forever chemicals that have ended up in water and basically everywhere. So I was able to work with them on that I started by doing an international overview of what the laws were in different countries, what were the abatement efforts, and then what were the private causes of action that could be brought to sort of, was it suing governments, was it suing corporations, that sort of thing.
Excellent. Just to restate the point that we are very flexible on internship. I mean, Jasmine did it in a law firm. I think it's a second or third student that does so, because if you have an opportunity, why not take it? As long as it's something health related, which was definitely the case. Gita, over to you.
Hello, everyone. My name is Geeta. I did the program in 2024-25. And I am presently working with the UN's International Organization for Migration in the Djibouti field office. In case you don't know, Djibouti is a country in the Eastern Horn of Africa. And the work that I do right now is supporting the information management unit on data visualization, which has nothing to do with what I worked on in the program. And yet I feel like I remember things that I've learned through the program every day, because along with the core academic classes, which we have, which are amazing, by the way, would strongly recommend. The soft skills that we learned, like Cindy mentioned, is they benefit me on a day-to-day basis, especially in a country like Djibouti, which is a very small country. So you're constantly networking. You meet the same people over and over again, like several times a week. And for someone like me who is not great at networking and like soft skills and talking to people and then remembering to talk to them a few months later, the program like very benevolently has they have actual like classes on, or I would say workshops on how to meet people, how to cold email, how to connect on LinkedIn, how to network. And I actually refer to those slides on a day-to-day basis because it's very helpful for me. And I think another thing that the program has done for me, which made me really comfortable in my present role, especially since I don't have a background in data analysis, is that at both Georgetown and the Graduate Institute, they have flexibility on the nature of the classes you take. So at Georgetown, I took a class that was part of the epidemiology program called Global Health Security. And at the Graduate Institute, I took a class on anthropology. And both of those were like very new subjects, very new ways of thinking. And I think that better prepared me to work on something that's so different from my like academic background. So yeah, I think that's how the program stood out for me.
Excellent. Thank you very much, Kita. Last but not least, Kashish.
Thanks, Gianluca, and hi everyone. This is Kashish Taneja. I'm speaking from Delhi, India. I did my LLM back in 2018-19, and it's been It was an exceptional year between both the Georgetown University and the Graduate Institute. And exceptional past almost 7 years so far. Probably, if you all are here in this webinar today, you're most likely confused between the full time at Georgetown and the half and half at the Georgetown Graduate Institute. So I'll try to frame my experience in a sense that which helps you get some clarity on that decision, because I'm doing that purposely because I've been asked that question a number of times, and I hope that helps. It's important to understand first what you are here for and what are you looking for before you find the right match for you. But because both the LLMs offer very different experiences, the Graduate Institute is an exceptional institute when it comes to issues on international relations as well as governance. Right from the faculty, you hear from the horse's mouth, whether it's Professor Burchi or Professor Moon. I was also taught by Professor Pokwa. He taught me trips and international IP law, who is one of the directors at WIPO. So legit from the horse's mouth. And then as far as the courses are concerned, you get a lot of interdisciplinary mix over there, especially a lot based on international relations. And then overall experience in terms of the city, in terms of other students from every other background, which end up being your batchmates. In my case, I got to work on a practicum at the Graduate Institute, where I was working very closely with the legal counsel at Gavi. And as part of my internship, I stayed back in Geneva and was working with the World Health Organization. A lot of work on NCDs, tobacco litigation, alcohol, and so on and so forth, which also to an extent formed part of the next couple of years when I worked extensively on NCDs issues. Right after my LLM program, I've been working primarily as an international consultant with a bunch of organizations. I work nearly full-time with the O'Neill Institute for National Global Health Law, also leading their work in Asia at the Center for Transformational Health Law. I've worked with Duke NUS, the WHO, the Public Health Foundation of India, a bunch of ministries in the Southeast Asia, and all of that, each day of my work, whether it was drafting policies or writing academic papers or op-eds or participating in international negotiations like right now with the pandemic agreement of the PABS NX. They've been memories that I recall from the LLM program, my experiences both at the Graduate Institute as well as Georgetown University that has helped me in everything I do today. And some of the faculty you meet, including Professor Gyan and Sarah Bosha, not only become your colleagues, but I think they become your lifelong mentors. And that's really exceptional to have. And so, yeah, happy to answer any questions. Thank you.
Thank you, Kashish. So as you can see, very different outcomes. Jasmine worked in a law firm. Now she works in a university. Geeta works in an international organization. I think you did your internship and even beyond in an NGO. Cindy is in private practice. Kashish is on an academic path. So I think it's important to the alumni go in different directions. And so to me, that's one of the attractions of these programs. They really can give you skills. And I like the way that you mentioned soft skills. It's not just what you learned and what you memorize, but it's also, again, the ability to network, ability to communicate. That's why both at Georgetown, at the Graduate Institute, we really try to expose you to the real life of global health. As Olivia recalled, we had briefings with WHO, with the Global Fund, with Gavi. It is a privilege for students to attend the World Health Assembly, to really go physically there and mingle with diplomats. So these are all things that are not strictly academic, but I think they're very important in giving the sense of what a program like this can offer. Also, the locations, Georgetown, Washington, D.C., beside, the center of power of the U.S., the Global Fund, IMF, the Organization of American States. Geneva is something like 17 international organizations, many of them related to health with the health program. So there are many things to say about the building blocks, if you want, of the programs. I don't see any question from students that are listening in. If you have any, please just go ahead. Sarah, can they take the floor or just?
Oh, we have a few more minutes and some questions are coming through, so we are typing them live.
Okay.
I think we have time for hearing from the alumni, maybe just even on the student life that Olivia spoke about, just the experience of being in Geneva, I think is also a big draw. Maybe the students can talk about that. The alumni, sorry. You are no longer students, you are graduates,
Yeah, alumni.
pursuing amazing careers. If you can talk about the experience of living in Geneva and what it meant for you, especially if this was your first time in this international city.
Geneva and Washington, I mean, in particular for non-American students, there's also that experience. Yeah, that's a good point. Anything in particular you want to contribute? Cindy, Geeta, Jasmine, Kashish?
I can start us off. I think I'll start with Geneva just because for me that was the more international experience. So I think what I really appreciated, one, there was very nice housing opportunities through the Graduate Institute. Make sure to apply when they tell you to apply. So that's important to do. But it's a very new building. It's walkable to the WHO. I think there's Labor is next door. There's all these lovely parks around on sort of both sides. But it's nice. There's a gym, there's laundry. They have cleaning service that comes every other week. That's also lovely. Uh, the prices, I would say, are comparable to the price of renting in DC, if not slightly better. Uh, but what's really nice is there's other students there. It's a good opportunity to meet other people within sort of the Graduate Institute community. You can easily walk to campus. You can take the bus if the weather's not great. Although I feel like for me, the weather was great 90% of the time. So I really enjoyed walking different places. You can also, depending on where people do their internships, a few people in my cohort ended up doing UN-based internships. So the UN has like a beach club, so we would all gather there and some days to just sort of hang out after work. I think Geneva as a city sort of it has a reputation of being very expensive, but in comparison to Boston or even DC, I think the cost of apartments and housing is less. The grocery store costs less. If you go out to a restaurant or order something like DoorDash, Uber Eats equivalent, that's anything that touches the service industry is more. And then if you need to go shopping, you should take either the bus or the train into France and do like if you want to do like clothing shopping, you want to do that, not in Geneva. But I really enjoyed going downtown. We would always meet up on my cohort group. There were 7 of us. We would meet every Friday and sort of have a pre-planned evening activity. And then during spring break, a group of us flew to Mallorca. And so we had a great time. We really tried to both meet people sort of on campus, other students, and then we would do some things with just ourselves. But I think it's a very easy city to navigate. People are eager to help. If you lose something, I guarantee it will be returned to you. My mom left her phone on a train, and I was my parents had previously lived in Germany. The Swiss definitely beat the Germans in returning lost items. That I was really impressed with how many people knew where this phone was, and they had a whole system of how it was coming back. Uh, and then on the DC side of things, like I grew up in Maryland, so I have more familiarity with DC, but I think I very much like where the law school is situated. I like that it has its own campus, just comparing it to law schools that are also connected to the undergraduate part of things. Like Georgetown Law very much has its own sort of full community space. Um,
Yeah. I'll
think
turn
that,
it to you. Oh, sorry. I'll turn it to you, Jean-Luca. There's some questions so that we can stay engaged with our audience. I put those in the chat for you.
Yeah, and please, Sarah, also go ahead. Um, so, professional from practice, how does LLM equip us to translate technical public health expertise and legal governance impact? That's in a way precisely the very much the purpose of this program, to give a decent um, exposure to the legal aspect of health, but also beyond to the governance aspect of health. You've seen the part of the courses, for example, the students can take in Geneva, talking about political science, economics, history, international relations, anthropology. These are all things in a way can equip you relatively well for a public career, where you're not necessarily a law firm where you deal really with the black letter law. And a number of students from those that we were able to track, because not everybody sort of stays in touch. At least 2 or 3 have moved to WHO. One moved to the World Bank. One found a job in UNFPA, the Fund for Population Activities. So quite a number found jobs in international organization. I think 1 or 2 found jobs in their own government, for example. So there's quite a bit of movement toward the public sector. And I think our hope, our expectation is that these programs gives you a good grounding in on the public aspect of law of law and the governance of health. The duration of the program is maybe you want to take that, Sarah? And the tuition, because that's really Georgetown material.
So the duration of the program is 1 academic year. You will go just a little bit over. Let me break it down a little bit. You will start your first semester in Washington, D.C. So you will be there from August until about December when the full semester ends. And most of our students will then leave for Geneva in the new year. Some try to leave a little bit before, which is still okay. Some want to go a bit early, get settled in. But by about January, mid-January, thereabouts, you should be heading to Geneva. You will study, and then you will also do your internship all the way from January up to about September, and then you will graduate. So you take just a little bit more time because of this unique opportunity that, number one, you're in Geneva, Switzerland, and number two, you're getting this opportunity to have an internship as part of your learning experience while you're in Geneva. And so that's really the duration. In terms of tuition, at the moment, tuition for the new academic year has not yet been set, but last year, tuition was 86,000. So we're looking at maybe like a 5% increase. There are some limited scholarships that are available for students, and there is a process for you to apply for those scholarships. And once you submit your application and you indicate that you want a scholarship, you will be put through the rigorous process we have to determine your financial need. And there was another question about how to apply. I will come to that later, but I'll share that information on a slide. But just on that response to the duration, the tuition, and whether or not funding is available.
Yes, and just to, because there has been a misunderstanding with the student that is coming to Geneva now, that he thought he had to pay additional tuition for the Graduate Institute. No, it's basically the Georgetown tuition covers the whole program. There is another question. Don't know if you want me to answer, Sarah. You want to?
You can start, and I can add anything that you'd like me to add.
Okay. So I cannot compare, give justice to the differences with the full Georgetown program. Sarah can obviously talk about that. As we explained, the ambition of this program is to combine fairly rigorous law preparation, so law program, together with the broader social science governance aspects. So to give you really quite a well-rounded preparation exposure in the law and governance of global health. So how it compares to the full Georgetown program, I leave it to Sarah. She's obviously much more qualified than me to describe it.
Okay, so I would say, if you are someone who is particularly seeking a career that's heavy on diplomacy issues, I would strongly, strongly recommend the Geneva program. Because again, the Graduate Institute is the top school on issues of international diplomacy and international governance. So really, you'll be getting the best of that particular type of education available anywhere in the world. Now, if you're sort of more interested in having options to either maybe sort of focus more on maybe technical or more on sort of the firmly legal side of things. Let's say you want to be a legal researcher, or for example, like Kashish, you want to deepen your experience in research and become an expert in certain legal issues around global health, or even like Jasmine, who is doing similar work around sort of delivering education or having technical expertise and know-how, or even teaching, then the national and global health law might be more suited for you. Some students have also thought about whether or not they want to do something like a New York bar. That might also be a reason why you might choose the National and Global Health Law, LL.M, versus the Geneva program. Some have thought about trying to build a career more in Europe, or thinking about building a career that has that trajectory of working for UN, WHO organizations. Then the Geneva program positions you very well for that and gives you that head start that you're right there at the heart of where many of these organizations are headquartered, to do your networking, to talk to people, to understand the situation. How can you get a job? How can you position yourself? So I think these are some of the questions that, for example, myself and Professor Birchie would have the time to discuss with you. So if any of you are sort of thinking, I'm just not sure, they both sound fantastic, you can reach out to me, we can have a conversation, and I can sort of help you pick the path that is right for you. But I'll also maybe turn to and put on the spot Kashish first, and then Geeta to answer that question. So I'll read the question out again. The question is, for applicants also considering the National and Global Health Law, LL.M, what would you say most clearly distinguishes the Geneva program in terms of course offerings and post-graduation opportunities? I'll start with you, Kashish, and then Geeta, feel free to jump in once Kashish is done.
Great, thanks, Sarah. So again, I would repeat what you said in context of, if you're looking for more of a governance exposure, I would any day choose a joint program. If you, for example, are looking to specialize into specific areas of drug laws, or like specific areas of IP issues, like subsets of specific fields of laws that intersect with health, I would choose more of the full year at the Georgetown University. So I think it's more about what you are looking for, and you should be clear about why are you doing this LL.M, and what are you expecting to get out of it, and that will be easier for you to decide upon which of the two courses are more helpful. But I mean, at the end of the day, another important consideration is how much easy or hard it is for you to move between cities every 4 or 5 months. That's not for everyone. Some people enjoy doing it, some don't. It can be a lot to change cities in terms of housing and so on and so forth. But the extra buffer time, which Sarah talked about, it's definitely something which is helpful in the entire process because I think it helps you to immerse the city a lot more in the entire year and a bit more. So I think I'll stop there.
This is a very practical thought, and it's probably like a small thing in the larger scheme of things. But what stood out for me, like the most, was that you benefit from the career office in Georgetown and in the Graduate Institute, and they're both focused on very different types of careers. Like the Graduate Institute's career office walks you through the Inspira website, which is the UN careers website. And they have webinars on very specifically on UN and Geneva NGO jobs. And Geneva CVs also look a little different from US CVs. And my current position, I got through the Graduate Institute Careers Portal, and the position I was before that, which Professor Bochi mentioned, I was a legal advisor for an NGO called Resolve to Save Lives, which I got through the O'Neill Institute. So I think that stands out a lot to me, and it's not something you should it's something you should take into account.
And so it sounds like the nice response is you can get a double whammy of support from both sides, right? You get support from us and you get support from Geneva. And I think Geeta's story is an example of that. You start from DC getting that support, you move to Geneva, you get additional support that deepens your experience. Whichever one of the tracks you choose, as Professor Birchie said, we have someone here who is now working at a law firm back home after having done the Graduate Institute program at a very well-known, well-renowned law firm. We have people here who are working at the global level. We have someone in academia. So whatever you're thinking of, whatever you're wanting to do between either of the two programs, but including especially the Geneva program, there is no barrier or bar to you then when you are looking for opportunities because it's such a well-regarded program and a well-respected program. And maybe I can use this opportunity to segue into just giving you guys an idea, just a snapshot of where our alumni work here because of our program. I hope you can all see so this is all the different places that they work: the UN, the WHO, World Bank, World Intellectual Property. Some of them even work at the Department of Health and Human Services. Again, in academia, as you see here, Medicines Patent Pool, Johnson & Johnson. And this is a mix. This is also including a lot of our alumni that graduated from this particular program in Geneva. Given the time, I'll just quickly go over how to apply in case that also brings up some additional questions. So for this particular program, you're going to apply the exact same way that you would apply for the National and Global Health Program. Using the LSAC platform, you will see the application form, and on the application form, it'll ask you to choose between either the National and Global Health Program or the Global Health Law and Governance Program. And so you select the one which you want to apply for. Then you also pay the application fee. For those of you that have attended the webinar, and of course, we've seen and taken note of you'll be able to get an application fee waiver, which I think is a really nice add-on for you when you're applying. You want to attach your resume, make sure to really highlight your interest in health or anything related to the work that we do, whether it's SRHR or so if you've, taken part in Model UN or something like that, depending on your years of experience or whatever research you've done, a paper that you've written, you want to sort of try and highlight and put all those things in your resume. The most important part of your application is the personal statement. This is really you presenting yourself and your reasons why you want to be part of our program. So let's say you made a mistake in the form or you couldn't find the place where to tick for this particular program. This is what your personal statement helps in us knowing where you want to go. You will clearly state which program you want to do. You will state the reasons why you want to do it. And my encouragement is to also talk about how do you think that this particular program is going to take you to the next level in your career or take you to the next level in whatever it is you're aspiring to do. So really take a lot of time with your personal statement. I'm going to summarize again. You want to hit the high points. Why are you interested in health law? Why are you interested in this particular program, and name it in full so that it's easy for us also to reaffirm that this is the program you're applying for. And then also how it is you hope this program will impact your personal career journey or your professional development or promotion, whatever it may be. For those that are have an education from a country where legal instruction is not given in English, you will need to take a TOEFL exam. If you've already taken a TOEFL, it must not be more than 2 years old for both the TOEFL and the IELTS. So the TOEFL has to be a minimum score of 100 and IELTS a minimum of 7.5. In some cases, you know, the score could be 98 or something like that. You can reach out and say, hey, my score is just 1 or 2 points shy of the requirement. And in some cases, then we can sort of have a conversation with you to assess your speaking and comprehension ability of your English language skills. And then you also, of course, need to submit your transcript or a registrar certification form. In most cases, the school will submit the transcript for you directly to us. And then missing from this list, but also critically important, you need to have at least 2 references that can talk about your interest in the program or just attest to your passion or attest to your own work ethic that will help you to successfully complete the program. So application form, application fee, resume, personal statement, your TOEFL, registrar certification, transcript, and then missing here is your recommendation letters. So if you have any question at any point, you know, you're looking through the site, you're trying to figure out, well, how do I apply? You're having difficulty navigating LSAC itself, please reach out to me. My email is right at the bottom of the slide, and I'm happy to sort of direct you to the resources we have at Georgetown. But you don't have to basically apply to the Graduate Institute and then apply to us. It's one and done application through LSAC to Georgetown for you to be admitted to this particular program. And I'll stop there in case there are any sort of additional questions from the audience. I see some in the chat. So someone is asking, during the first semester, is there any possibility to switch between the 2 LLM programs, or are students expected to commit fully from the start? I will say we would love for you to commit fully from the start if possible. We do know that people change their minds, but for the LLM in global health law and governance in Geneva, there's a cutoff date for you to switch. So in November, and we shared that date with folks the moment you're admitted, and we're sort of helping you process your paperwork. By November, you can no longer switch programs and you will have to proceed with this particular track. We try and do this for continuity. We try and do this to make sure that, you know, as they have prepared for you in Geneva and they've put in place a lot of different aspects of the program, that you are able to enjoy those benefits, but also for you so that you can have some continuity yourself in your studies and some clarity in what it is you're going to do. So there's time for consideration, but you know, I would encourage you to really reflect strongly. I am happy to connect you to a lot of the alumni, including those here on the chat today. You know, do your research, talk to folks from both sides of the program, and really take your time to think through what is it that you would like to do, what is the right fit for you. I don't know if there's anything else, yes, that you want to add. Do you want to come in, Professor Berchi?
No, I think we covered everything. I don't know if Olivia has anything to add on the practical aspects of the Geneva side.
No, it's fine.
Okay. Okay, so I hope we did a good marketing job.
I hope so. I hope everyone understood. Maybe just to round us off, since we have 10 minutes and it looks like one question just came in, so more will be coming in. I want to start maybe with Jasmine, but just going around, and you can popcorn it over to another alumni. You know, if you had like one major pitch, one major sentence to encourage someone to apply to the program in Geneva, what's your pitch? What's your selling point as someone who's, you know, bought this, into this, gone there, experienced everything, and here you are flourishing in your careers respectively?
Yeah, I would say this would be specifically as someone who is educated exclusively in the United States prior to going to the Graduate Institute. I think it completely changed the framework in which I approach international issues and the diversity of opinions, countries, thoughts that are represented both at the LLM at Georgetown and when you go to the Graduate Institute. I think it is a really enriching environment. It's a really supportive environment. And I think there's 100% chance you will walk away uh, feeling as if you got your money's worth. I think it's an excellent program all around. I can popcorn it to Gita.
For me, and this is maybe a little unconventional, the top selling point is the friend group. I think there were 25 people in my program, and I am in touch with every single person today just as friends because I do things and I'm like, oh my God, I have to say this to Shabna or I have to tell this to Cindy and um, yeah, and it was like and even though we only spent 6 months with the national and global health law students who do the entire year in DC, we formed such deep, wonderful connections. And I think it's a really useful friend group to have moving forward, mostly for emotional support because I need that a lot, but also in terms of networking and career development.
I think Ashish dropped out, but Cindy, and Ashish there.
I'm here. Yeah. So I would say all of the above because, but like I definitely found the fact that the batch size is small. It makes every class much more intimate, and as Gita mentioned, your friends also become your colleagues. They become the most important network you'll have, and it's a small cohort and small network across the world of lawyers who specialize in health laws. And apart from that, for me, the joint program was the most value for money I think you could find in any master's in law program across the world. And I could list empty number of reasons for that. So I'll just stop there.
Cindy.
Yeah, so actually, I want to emphasize that I know some candidates may concern that the Graduate Institute is not that high ranking, but this is actually because the Graduate Institute doesn't have a bachelor's degree, and many rankings, they do the ranking like to consider both the like the bachelor's degree and both the quality of the master's degree. And like the ranking of the Graduate Institute doesn't mean that is I mean it has no relationship with the quality of the teaching. Like you can search on LinkedIn of all the professors in the Graduate Institute, and you can find that almost all the professors at the Graduate Institute has very good educational background, like from Yale, from Stanford, and most of them have some like not only study experience but also working experience in the United States, like or in the international organizations. So don't think of the two universities as that separate. Actually, they are very uh, combined, and there are many liaisons between the two universities. If your employers think that you don't have a good background because he doesn't know about the graduate institute, it just means that the employer has doesn't have a very good recognition of the world, like doesn't have know much about the world, doesn't have a very high level of the world. It doesn't mean that like your background is not good, and you can definitely choose the employer who knows the graduate institute, which means the employer like has a very broad and have a very comprehensive understanding of the global educational system.
Thank you, Cindy. You did some additional sales agent work for the Graduate Institute. Much appreciated. And that's something I should have mentioned, that indeed, the Graduate Institute only has master and PhDs and doctoral programs. It dropped the undergraduate a long time ago. And so it's a bit of a strange animal. It's not a full-fledged university. It's really an institute of higher learning in the Swiss academic system. So thank you very much. That's an important point.
Okay, so I think we will stop there. And I just want to thank all of our panelists for coming, especially, our alumni, Jasmine, Geeta, Cindy, Kashish. We appreciate you so much. And of course, the team. We are one team from the Graduate Institute, so we don't have to thank ourselves. But I will say this, it's an exceptional program. If you want to open up your worldview, if you want to have a truly global education, if you want to be exactly where global health law, policy, governance, you name it, and politics all meet and intersect and have that true understanding, and also enjoy being within the European region and experiencing that different culture, then this is the right program for you. We encourage you to apply. Our applications will be open right up until July 1, but the sooner you apply, the better. And please, if you want to speak to any of us here on this particular panel, please reach out. You can reach out to me, and I'm happy to connect you to any of the colleagues that are here. Thank you, everyone, for attending, and thank you so much to our panelists.
Thank you very much. Hope to see you in Georgetown and Geneva. Okay. Bye-bye. Thank you. Thank you so much.